why doesn't your thyroid medication work? Well, simply, it may not be addressing the problem that you have, because you need to understand the thyroid system. So the thyroid medication that's traditionally given out to individuals with hypothyroidism is affecting just the thyroid gland and nothing else. So as you look at this, and if you looked at my previous videos, you know that the thyroid is really a system of things that all come together in order for you to have a proper functioning thyroid. So if it's not the thyroid, which you're taking medication for, then the medication's not going to work. You could take all the medication in the world and it's not going to work. So one of the things I want to talk about today is that what other piece of the thyroid system may not be working that the medication has no effect on. And that is something called under or over conversion. Now here's what this means, is that the thyroid gland produces a hormone, but it's the inactive thyroid hormone, which is called T4. Basically what that means is that there are 4 iodine molecules attached to it. Okay, that's T4. So what happens then is that the thyroid hormone produces T4 and it gets bound to a protein, which is sort of the transport protein, which this taxicab is, and it's taken to the liver, where that T4, okay, the other iodine molecule is taken off it. And it's taken off by something called 5' deiodinase, basically taking the iodine off of it. And that makes it T3, which is the active form of thyroid hormone. And then it goes to the rest of the system and it does what it's supposed to do. Now, and then actually the other piece of that, it's called reverse T3, is sort of given away and put into the back end of the system and reprocessed. So what happens if this is broken? If the conversion is not happening? So you could take all the medication you want, and if it's not getting converted, heck, it's not going to work. What happens if you overconvert? In other words, you make too much T3. Well, that can cause other problems, which I talked about earlier, like receptor resistance and stuff like that. So if you have a problem with this, you got to fix that. That's the underlying cause of your system, your hypothyroid symptoms as well. I mean, medication's not going to take care of any of that. Now, how do you figure this out? Well, first off, let's talk about some of the possibilities that can affect that. And one is, if you're inflamed, what if you have an autoimmune disease or you have chronic inflammation? What if you're constantly tired, and what if your joints are always aching? That's going to affect this, okay? The other thing that affects is, what if you have bloatiness? What if you eat something and you don't feel really well? You have the runs, you have diarrhea, or you have constipation. That's going to affect this. What if your testosterone levels are too high? For whatever reason that may be, that's going to affect it as well. So you understand that it takes a lot of work to figure out why something is going on here. And once you know why, you can take care of it. It's that simple. So let's talk about how we look at our thyroid, or how traditional medicine looks at a thyroid. They give you a blood test and they say, oh, well, let's look at your what's called TSH, which is thyroid stimulating hormone, and let's see how that looks. Well, you feel pretty bad, your hair is falling out, you're bloated, you're fatigued. Well, let's look at the TSH. Maybe it's your thyroid. And lo and behold, the TSH, oh, that's actually normal, so it's not your thyroid. Or they say, oh, your TSH is kind of low or kind of high, we need to give you some medication. You take the medication and nothing happens. So is this enough? Is that blood work, a blood test, is it enough to look at the TSH? I say no. There are at least 9 different markers or blood tests or markers or whatever you want to call them that you need to look at to understand if the thyroid system, or what we call about the physiology of the thyroid system, is working correctly. So let's just look at, why don't we want to know the concentration levels of reverse T3? You think that if this is really high, if there's a lot of T3, maybe we're over-converting, or if there's not enough, maybe we are under-converting. That's one piece. What if we were to look at the concentration of T4. Now there's two types. There's something called free T4 and also total T4. Maybe we need to look at the concentration of T3. T3 total and T3 free means T3 free means that's the amount that's not bound to a protein floating around. Okay. Why don't we look at, the uptake of T3? In other words, how the T3 is reprocessed into the system. What if that's broken? Okay. We also want to know if you have any kind of autoimmunity problems. You may actually have autoimmunity to the thyroid gland itself, or to the transporting of the thyroid gland, or to the liver, or to this, the enzyme. It's very possible. Those things we can find out. But it takes work, it takes time, it takes understanding. It takes a very good, thorough history to find out what's going on. So if your practitioner is not understanding this system, you're not getting what you need. I'm sorry. So remember, if you want to live better, eat better and be active.